Hello, my name is Dr. Pavel Klein. I'm a neurologist and an epileptologist in Bethesda, Maryland, where I'm the director of a private epilepsy center called the Mid-Atlantic Epilepsy and Sleep Center. In terms of the impact on patients, these are patients whose lives have been taken over by epilepsy. The goal of zero seizures is obvious. It's obviously hugely important. And I think the difference is that we now have a tool to try to reach it in those patients who have previously failed to reach it. And with it, we have the hope to try to reach zero seizure freedom. So I would encourage both healthcare providers and patients to think of that as a possibility and something that is worth trying to reach out for. I think that if you have a patient who has not responded to a medication, be it 5 or 6 medications, but also early on, even patients who may have failed 1 or 2 medications, XCOPRI is definitely a medication they should try. I also use it in patients who have shown refractoriness early on in their epilepsy career, because XCOPRI, I think, has the potential to bring them a substantial seizure relief or seizure freedom. I think that the trials show that XCOPRI appears to be very effective. And I think that if you have a patient who has not responded to 2 or 3 or however many medications, XCOPRI is definitely a medication they should try. With the explanation of everything that a medication can do, both in terms of efficacy and side effects. But it's a medication that has the potential to make a difference. So because of that potential, I would encourage both the patients and the healthcare providers to give XCOPRI a chance. And yes, you may have side effects, the somnolence, the dizziness, the fatigue, the ataxia that we've spoken about. But I would encourage you to try to work through them, both by the titration course and by adjustment of concomitant medications, and give XCOPRI a chance to see whether it can make that very substantial change that we've seen it make in a significant proportion of patients that have been on it so far.
Thanks for watching this XCOPRI KOLCast video. Are you ready to get your patients started on XCOPRI? Request a meeting with your SK Life Science representative. Please see the important safety information at the conclusion of this video. You can also access the important safety information and prescribing information by clicking the links at the top of this page. Important safety information and indication for XCOPRI, cenobamate tablets, CV. Contraindications. XCOPRI is contraindicated in any patients with known hypersensitivity to the compound or any of the components of the drug product. XCOPRI is contraindicated in patients with Familial Short QT syndrome. Warnings and precautions. Drug reaction with Eosinophilia and Systemic Symptoms, DRESS, also known as multi-organ hypersensitivity, has been reported in patients taking antiepileptic drugs, including XCOPRI. DRESS has been reported, including 1 fatality when XCOPRI is titrated rapidly, weekly or faster titration. No cases of DRESS were reported in an open-label safety study of 1,339 partial-onset seizure patients when XCOPRI was initiated at 12.5 milligrams per day and titrated every 2 weeks. This finding does not establish that the risk of DRESS is prevented by a slower titration. However, XCOPRI should be initiated at 12.5 milligrams once daily and titrated every 2 weeks. DRESS typically, although not exclusively, presents with fever, rash, and/or lymphadenopathy in association with other organ system involvement. Eosinophilia is often present. If such signs or symptoms are present, the patient should be evaluated immediately. XCOPRI should be discontinued immediately and not restarted if an alternative etiology for the signs or symptoms cannot be established. QT shortening. XCOPRI can cause shortening of the QT interval. Caution should be used when administering XCOPRI and other drugs that shorten the QT interval, as there may be a synergistic effect on the QT interval that would increase the QT shortening risk. Suicidal behavior and ideation. Antiepileptic drugs, AEDs, including XCOPRI, increase the risk of suicidal thoughts or behavior in patients taking these drugs for any indication. Patients treated with any AED for any indication should be monitored for the emergence or worsening of depression, suicidal thoughts or behavior, and/or any unusual changes in mood or behavior. Advise patients, their caregivers, and/or families to be alert for these behavioral changes and report them immediately to a healthcare provider. Neurological adverse reactions. XCOPRI causes dose-dependent increases in the neurologic adverse reactions, including dizziness, diplopia, disturbance in gait and coordination, somnolence, and fatigue. Prescribers should advise patients against engaging in hazardous activities requiring mental alertness, such as operating motor vehicles or dangerous machinery, until the effect of XCOPRI is known. Withdrawal of AEDs. As with all antiepileptic drugs, XCOPRI should generally be withdrawn gradually because of the risk of increased seizure frequency and status epilepticus. But if withdrawal is needed because of a serious adverse event, rapid discontinuation can be considered. Most common adverse reactions. In adult adjunctive therapy placebo-controlled clinical studies, the most common adverse reactions that occurred in XCOPRI-treated patients, incidence at least 10% and greater than placebo, were somnolence, dizziness, fatigue, diplopia, headache. Dosing considerations. Dosage adjustment of XCOPRI or other concomitant medications may be necessary. Consider gradually reducing phenytoin dosages by up to 50% during initial titration. Consider reducing dosages of phenobarbital and clobazam as needed when used concomitantly with XCOPRI. When XCOPRI and carbamazepine or lamotrigine are taken concomitantly, consider increasing dosages as needed of carbamazepine or lamotrigine. Consider increasing dosages as needed of drugs which are CYP2B6 and CYP3A substrates, and decreasing dosages as needed of drugs which are CYP2C19 substrates. Effectiveness of hormonal oral contraceptives may be reduced when administered concomitantly with XCOPRI. Women should use additional or alternative non-hormonal birth control. Dosage reduction of XCOPRI may be considered in patients with mild to moderate and severe renal impairment. XCOPRI use is not recommended in end-stage renal disease. The maximum recommended daily dose is 200 milligrams for patients with mild or moderate hepatic impairment. XCOPRI use is not recommended in patients with severe hepatic impairment. Drug abuse. XCOPRI is a Schedule V controlled substance. Indication. XCOPRI is indicated for the treatment of partial-onset seizures in adult patients. Please see full prescribing information.